Hello, Assalamu alaikum students. In this video, I'm going to discuss about the hip joint regarding any joint. First of all, definition of joint. Joint is an anatomical entity where two or more bones they come together and they articulate with each other. So joint is a place where actually movement takes place, and movement always takes place with the help of muscles. So regarding any joint, whenever you are studying or discussing any joint, you have to go through certain, aspects of the joints. For example, you discuss the joint with its articular surfaces, means which are the bones which are participating in the formation of that joint. Then the capsule and ligaments of that joint, then its nerve supply, blood supply, movements, and there are certain clinicals which are respective clinicals which are related to that joint. So first of all, I will talk about the type and variety of the hip joint. Hip joint is ball and socket type of joint. As we all know that acetabulum is in the shape of a socket and spherical head. It acts as a ball, so it is a ball and socket type of joint, synovial joint. Then articular surfaces in further detail, acetabulum of hip bone. It is one of the articular surface, and the other articular surface is, the head of the femur. So now I'm going to, talk about further about the acetabulum. So here you can see this is the acetabulum. This is the excuse me. And here you can see this is acetabulum. Acetabulum is a cup-shaped structure. It has got a boundary which is called acetabular margin, where here you can see where I'm, my cursor, as you can follow my cursor. So this is the acetabular margin. Here we have got a specific type of cartilage which is called fibrocartilage, which is attached here. Then this acetabular margin is deficient inferiorly. Here you can see it is deficient inferiorly, and this inferior margin here the acetabular margin, it has disappeared. So here actually ligament which is called transverse acetabular ligament, it actually spans or bridges between these two ends. Then you can see this acetabulum floor of the acetabulum. Here you can see three different colors. Actually acetabulum is being formed by the contribution of three bones. For example, this upper part is being formed by the ilium. Then here we have we can see that this part of the blue part of the acetabulum is being formed by the ischium, and then anterior pink part is being formed by the pubis. So here you can see a Y-shaped union. In case of children, here you get triradiate cartilage is present, just like the the emblem or monogram of Mercedes-Benz. So further, here you can see here you can follow my cursor here. This horseshoe shaped structure here, this inverted horseshoe shaped structure is called as this is called lunate surface. It is called lunate surface because of its similarity with the moon, lunate surface. This particular lunate surface is articular. It means that this is the surface which actually comes into contact with the head of the femur, and it is covered with hyaline cartilage. Wherever there is a wherever there is a articulation, the articular surface would be covered with the hyaline cartilage. And here you can see a depression in the center. This is non-articular part of a hip bone, non-articular, and this is called acetabular fossa, and it is filled with fat and ligamentum teres. Now, I have certain, description is written in the boxes here. Here again, you can go through with the text as well. Here again, you can see the ilium ischium, pubis, and acetabulum is being formed by the union of these three structures. And here we have got, lunate surface and then acetabular fossa. Okay, here in this particular, diagram, you can see the lunate surface. It is actually a, articular surface because it articulates with the head of the femur. And it is covered with hyaline cartilage. Whereas in the central non-articular part, acetabular fossa, it is devoid of or not covered with the hyaline cartilage. Now, I'll talk about the capsule. Capsule of any joint, it wraps the joint in such a way that it wraps from all around, all around. Here you can see a window has been cut just to make you, understand, or just to help you understand what are the deeper structures. Actually, it is, all covered with the capsule joint. So what is capsule? Capsule is actually, here you can see again, here a window has been cut. Actually, this is all capsule, capsule of a joint. Here you can see. So regarding any capsule, look in this in this diagram. In any capsule, this is a one, joint, synovial joint has been shown here. Actually, these are the two bones which are participating in a joint formation. Here we have got joint, and this is the articular surface. This blue one you can see, this is hyaline cartilage, and hyaline cartilage is special type of what you cartilage, cartilage or soft, a connective tissue which covers the articular surface only. It covers only the articular surface again. And here we have got joint cavity which is present between the two articular surfaces. This is one bone and its surface is covered with hyaline cartilage. This is other bone which is a participant of a joint, and it is also covered with a hyaline bone, hyaline cartilage. And in between these two cartilages, here we have got joint cavity. It is filled with a special type of fluid which is called synovial fluid, and this synovial fluid comes from the synovial membrane. And what is synovial membrane? Here you can see, this is joint capsule. This is joint capsule, and this particular diagram is coronal section of a joint. And this any capsule, it basically comprised of two layers. The outer one is fibrous. Here you can see where I'm moving my cursor, the white one, and the light green one inside. It is actually a synovial membrane. It is synovial membrane. So capsule consists of two layers, outer fibrous, inner synovial. And this synovial membrane, it's attached onto the articular margin. This is articular margin here, where hyaline cartilage stops there. This is called articular margin. So this synovial fluid, green one, it produces fluid into the joint cavity, which further lubricates the joint and help in the articulation, or without friction the bones move on one another. And here it is another simple diagram just to make you understand what actually capsule is. So this is capsule, capsule of a joint. This is coronal section, and coronal section, this is outer fibrous, inner synovial layer. Here synovial layers. And then this blue one is the articular cartilage, which is hyaline cartilage. And here we have got another articular cartilage, hyaline cartilage of a other bone of a joint. And this synovial membrane, it attaches to the articular border. It doesn't go beyond the this on the onto the articular surface, because articular surface is covered with hyaline cartilage only. And here we have got ligament. There are two types of ligaments. One are extrinsic ligaments and one are intrinsic ligaments. And what are intrinsic ligaments? Intrinsic ligaments are actually nothing, just it is a thickening of this outer, what you call, fibrous layer of a joint capsule. And these are extrinsic ligament. And I will again Okay, this capsule, just to make, I don't want this video to be much longer, so I'm going for the, you know, just capsule related to hip joint. And here, this is the capsule. This here we can see the hip joint capsule consists of three ligaments. Three ligament. Again, ligament is nothing but thickening of a intrinsic ligament is nothing but the thickening of a capsule itself. This particular structure, which this is anterior view of the hip joint, and here you are looking at the same joint from the posterior aspect, and here we have got iliofemoral ligament. Iliofemoral ligament, because on medially it is attached to the ilium bone, anterior superior iliac spine, and here anterior inferior iliac spine. Medially this ligament is attached to the anterior inferior ligament, then its fibers move downward and laterally, and they are attached onto the intertrochanteric line. Intertrochanteric line, greater trochanter, lesser trochanter, between them there is a line, and this particular ligament is a Y-shaped ligament, Y-shaped ligament, and it has got two limbs, two limbs, upper limb and lower limb. So again, the name of this ligament is iliofemoral, because it is on one end attached to the ilium, and others and it is attached to the femoral bone. So again, the other second part of this, the joint capsule ligament, important ligament, is pubofemoral. Here you can see, if I better move to the next diagram, which is colored, so you can very well differentiate between these structures. So this here you are looking at the anterior inferior iliac spine. This is the pink one is the iliofemoral, because on one end it is attached to the ilium, and other end it is attached to the intertrochanteric line. It has got two limbs, upper limb and inferior limb, and it is a Y-shaped ligament, whereas the green one is pubofemoral, because it is attached on one end, medially it is attached to the pubis bone, and laterally it is merges with the iliofemoral and attaches onto the intertrochanteric line. So look at the direction of these fibers, downward and laterally and spiral, and they wrap themselves, ligament wraps itself onto the neck of the femur when extension of a femur is attempted. So these two ligaments, they actually limit or resist the hyperextension of this femur. And this is the posterior aspect of the ligament of the capsule. Here you see, this is the third type of the band of the ligament. Medially attached, it is attached to the ilium bone, ischium bone here, and laterally it spiraled itself onto the neck of the femur. And here you can see, it is a it is not attached with this intertrochanteric crest. Just before intertrochanteric crest, it wraps itself around the neck, but it doesn't attach itself with the neck here. It doesn't attaches itself with the neck here. So again, there are three types of ligaments. I have added few slides with all the text written on them. So actually, three types of ligaments or capsular ligaments are they have got their name: iliofemoral, pubofemoral, and ischiofemoral. If you look carefully, the femoral word is common in all the ligaments, because on laterally these all the ligaments, they attach themselves onto the femur. That's why they have the word femoral in their name. Whereas the medial one is attached to medial part of the ligaments attached onto different bones. This pink one is attached to the ilium, the green one attached to the pubis, and the yellow one is attached to the ischium. So that's why they have got three different names: iliofemoral, pubofemoral, and ischiofemoral. So here you can see this protrusion. This is actually protruded part of the synovial membrane, and here it acts as a bursa. And bursa is what? Bursa is a just to remember, it is a structure, special structure, which is present between the bone and the tendon. Whenever there is a tendon comes into direct contact with the bone, there is a bursa present. It actually in general anatomy you are going to learn more about the bursa. Just right now, just remember it is a synovial protrusion. So again, this is head of the femur. Here we have got a special type of depression which is called fovea centralis. Whole of the femoral head is covered with a specialized type of cartilage which is called hyaline cartilage, except for this fovea centralis. And here we have got a special type of ligament which is called ligamentum teres. Actually, if you look carefully, they have cut this ligamentum teres. Otherwise, it is a continuous structure. It has got one cylindrical structure, rounded ligament. On one end, it is attached to the head of the femur, and on other end, it's broader and it gets attached itself to the. This is transverse acetabular ligament. If you further look carefully, and you can see a red spot or dot within the center of this ligament here. Here. It is actually a blood vessel, which is a branch of obturator artery. Here we have got obturator artery. Obturator artery. It is branch of obturator artery, and this branch traverses or passes through the, ligamentum teres, just like the way, graphite passes through the lead passes through the lead pencil, all around surrounded by wood, and in the center we have got lead. So likewise, this artery is passing through the ligamentum teres and supplying the head. So again, I'm going with the further, this diagram is very important. Let me explain this diagram. Yeah, what is actually happening. Look at this. This is head of the femur, this is neck of the femur, and this is greater trochanter. Here we have got lesser trochanter, and this is coronal section of a hip joint. And here we have got acetabulum, and this head is is covered by means of a hyaline cartilage. Here you can see hyaline cartilage. This is all hyaline. Blue one is hyaline cartilage, and this is ligamentum teres. An obturator artery branch is traversing this ligamentum teres and supplying the head of the femur, medial part of the head of the femur. Now, if you look carefully, here you can see, let me further zoom in. Oh, sorry. Okay. If you look, this is epiphyseal line, a very vague epiphyseal line. Here, whereas the rest of the bone is spongy. There is a part of head of the femur which is medial to this epiphyseal line, this one. And there is a part of the head which is lateral to this epiphyseal line here. So medial part of the head which is medial to epiphyseal line, and part of the head of the femur which is lateral to the epiphyseal line. They are supplied by from arteries from two different sources. Look at this one. The medial part is being supplied by this obturator branch, acetabular branch of obturator artery, whereas lateral part is being supplied by branches retinacular arteries. These retinacular arteries are branches of the medial and lateral circumflex arteries, which are branches of the profunda femoris artery, which I'm going to discuss in a bit in detail. So look at this is fibrous this is capsule of a joint. So what is actually happening? This capsule actually it wraps the joint all around. But as you are watching or looking at the diagram in coronal section, so this is outer fibrous layer, the thick one, whereas this completely white one here, where cursor is, this white layer, this is synovial layer. This synovial layer reflects along the neck of the femur here, and then it moves further and attaches itself to the acetabular margin. And these arteries, which is called acetabular artery, it passes beneath this synovial layer, and this is called retinacula, and these arteries passing through beneath this synovial layer are called retinacular arteries. And these arteries are very important. And again, here, look at this thing. And in this, this is outer, the thickest one is the, capsule. These are the same capsular ligaments which we discussed earlier, pubofemoris and, iliofemoral and ischiofemoral. Uh, here you're looking at, and here this white one, this is synovial layer. This synovial layer, it comes and then it folds upon itself and moves along the neck of the femur here, neck of the femur, to get attached onto the acetabular margin here. Sorry, what articular margin. And this artery which passes beneath this layer, these are called retinacular arteries. In case of children, whereas epiphyseal cartilage is physically present in the form of hyaline cartilage, but as this hyaline cartilage, the in case of adults, hyaline cartilage is no more, because there is synostosis or fusion of the medial and lateral part of the heads. And finally, as a result, these retinacular arteries, in case of adult, these retinacular arteries and this acetabular artery branch, they fuse with each other to form an anastomosis. Anastomosis means network of blood vessels. Okay. Uh, Now I'm going for this. Look at this. This is femoral artery. It has got its branch, which is called deep profunda femoris or deep femoral artery. It further has two branches: medial lateral and medial circumflex. The word we use, these are the names of the arteries, and they have been named circumflex because they wind around the upper end of the humerus, both of them, one from anterior aspect and other from the posterior aspect. So circumflex word came from the circumference, like circumference of a, when any structure it winds around other structure. So in that case, sometimes the structure they have been named as circumflex. So medial lateral circumflex and medial circumflex. Now look at this. Lateral circumflex has three further branches: ascending branch, transverse branch, descending branch. And ascending branch, it has got branches which penetrate the capsule, iliofemoral capsule, and then they move along the neck of the femur. Here you can see neck of the femur. So this was the blood supply. Again, here you can see these are retinacular arteries, from lateral circumflex. Retinacular arteries, these are the retinacular arteries. And here in coronal section, you are looking at these retinacular arteries here. And this is the, acetabular branch of the obturator artery. And they fuse together with each other, they make contact with each other in case of adult and result in a formation of anastomosis. So here you can see, here in this diagram, anastomosis has not been shown actually, because this is a diagram, a handmade diagram, but I put this diagram in this video just to make you understand. Here, look at this thing. This is here fracture of the neck of the femur. And whenever there is a fracture of the neck of the femur, there is disruption of retinacular arteries, because retinacular arteries are intimate relationship with the neck of the femur. So whenever there is a fracture of a neck of a femur, there are chances that these arteries, retinacular arteries, they get disrupted as well. So as a result, the head of the femur would be left with only one artery. Otherwise, blood supply to the head of the femur would be discontinued, because these retinacular arteries, they have been ruptured, and only this acetabular branch would remain. But the blood supply by this artery is not enough to save the rest of the head. So as a result, there would be a condition called avascular necrosis of the head avascular, because avascular means lack of blood supply, because these arteries which are called retinacular arteries, they have been ruptured or disrupted. As a result, there would be no blood supply to the head of the femur except from this small artery, which is not enough to for the vitality of this head of the femur. As a result, this head of the femur, it would result in necrosis or death of a tissue, and this condition is called avascular necrosis of the head of the femur. So again, this is, look at this, and this is deep femoral artery, lateral branch, medial branch. So medial branches, medial circumflex give more, blood supply to the head of the femur as compared to the lateral one. So this is acetabular artery, which passes through the ligamentum. These two branches, acetabular and retinacular arteries, they fuse within the head and result in anastomosis. So this particular diagram I have put here just to make you, aware of the actually how head of the, as hip joint is can be seen or visible in case of X-ray. This is X-ray femur, and here you can see this very well circumscribed and rounded structure is called head of the femur, and this is called acetabulum. And here we have got neck of the femur. This is greater trochanter. Here we have got lesser trochanter. uh, Look at the, roundness of the head. It is very well sharply rounded, so it is normal X-ray. Now this is normal structure. Here you can see this is normal, and here a part of head, it has been, necrosed, and it has been destroyed. Look here, it is showing that as small blood vessels, they are either disrupted or there's a clot within these blood vessels. As a result, blood to the head of the femur would be, disrupted. As a result, head would be destroyed. Now look at this. This again, very well circumscribed head of the femur. Here, head of the femur. This is neck of the femur, greater trochanter, lesser trochanter, acetabulum. Now, this diagram is for comparison. Now look at this here. Look at the right side of the image, very well circumscribed head, and here in this case, the roundness of the head is gone and it is D-shaped. This is called avascular necrosis of the head, acetabulum. Again, look, this is very well round head of the femur, and here in on the other side, the roundness of the head has been disturbed, and there is this, head is more dense. It seems that either it is avascular necrosis or a fracture of the head of the femur. See, fracture of the head of the femur. And here we have got pubis bone, upper superior ramus, inferior ramus. This is ischium, and this is symphysis pubis. And here we have got ilia on two sides, and this is sacroiliac joint. Okay, so okay, now hip joint, the nerve supply of hip joint. Nerve supply of any joint is based on Hilton's law, and Hilton's law states that whenever there is there are many muscles which are actually which pass the, any joint, in front of the joint, behind the joint, on its lateral aspect, on its medial aspect. So because we discussed or have already discussed that the movement on a joint is produced by the muscles. So whenever Hilton's law states that whenever, any muscle passes in front of that joint, the nerve supply, the motor nerve supply of that joint, the nerve supply of that joint would also be supplying the, of that muscle would also be supplying the joint as well. So there are certain, nerves which are femoral, obturator, superior gluteal nerve, nerve to quadratus femoris, sciatic nerve. Yeah, right now you just have to remember these names, but later on when you will, further discuss the different muscles and different, nerves, you will have better understanding what actually Hilton's law is. But for right now, Hilton's law is that Hilton's law states that whenever any muscle it crosses any particular joint, the nerve supply of that joint also supply of that muscle also supply the joint as well. So movement, there are certain movements which take place on this hip joint, and these are flexion, extension, adduction, abduction, medial rotation, lateral rotation, circumduction. So they all take place on this joint, and there are certain muscles which are responsible for these movements, and uh, uh, which you will discuss later. And here we have got a condition which is called actually it is called dislocation of a hip joint. Dislocation of hip joint is of two types: congenital dislocation and acquired dislocation. Congenital dislocation is due to is congenital. Congenital means by birth, so it is more present, more common in females, and because of acetabulum is not properly formed, properly formed. As a result, it is not deep enough to hold the head of the femur. It is shallow, so most of the time the head of the femur it comes out of the head of the acetabulum. Here you are looking at the head of the femur, and here this is the acetabulum. On the left side, this is dislocation of the head of the femur, and on right side here you are looking at the rounded, very well circumscribed head present within the acetabulum. So this here you can see the head of the femur. It has lost its roundness, and there may be fracture or avascular necrosis. But in this, X-ray, you can see a metal, a screw or nail. It has been used to fix the, neck of the femur. So most of the time, these are the screws. Orthopedic surgeon, they do this job and they do it perfectly. And look at this here we have got fracture, so part of the nail has been passed into the neck, and rest is screwed to the rest of the shaft here. Again, this is neck of the head of the femur, very well circumscribed, very rounded head, and here you can see this is actually the fractured neck of the femur. So here screws they are actually passing through just to make fix the head of the femur. Again, this is epiphyseal cartilage, and this is medial part of the head. Sometimes it gets detached itself from the rest of the head, and this is called slipped epiphysis, and it commonly happens within in adolescent age, in bulky individuals like a bulky kid of 13, 14, 16 years of age, athletic or sporty. He's bit bulky but athletic or sporty. So most of the times this can happen, and this is called slipped capitis or slipped head of the femur. Here you can see this is head of the femur, and here rest of the head of the femur, epiphyseal cartilage, and it slipped from it. Again, screw to fix it. These are slipped capitis. Okay, this epiphyseal cartilage here, because this part is weak, because epiphyseal cartilage it is still there. There is no synostosis because this fusion of the medial and lateral part of the head it happens when in adulthood. Okay, so here you can see slipped capitis, malformed acetabulum. As a result, head comes out and it moves upward. Okay, for the few things about the dislocation. Dislocation is actually, I talked about congenital dislocation. Now, the dislocation which is called acquired dislocation. Acquired dislocation happens, for example, when somebody has had an collision and his bended knees they strike against the dashboard of a car. As a result, acetabulum comes, the head of the femur comes out of the acetabulum. Now there are two conditions. If the head of the femur is, when it comes out, it is moved behind the acetabulum. It is called posterior dislocation. If the head of the, disengaged head of the femur, it is present in front of the acetabulum or pubis bone, it is called anterior dislocation. So most of the time posterior dislocation takes place, and posterior dislocation further produces some problems, because sciatic nerve is in the gluteal region. It gets stretched or damaged. As a result, the muscles and skin supplied with the sciatic nerve, they are also paralyzed, or cutaneous innervation is lost, whereas anterior dislocation. And in both the cases, in case of posterior dislocation, in case of posterior dislocation, the thigh is adducted and medially rotated. And medially rotated, here you can see adduction and medially rotated. Whereas in case of anterior dislocation, the leg is laterally rotated, and in both the cases, the especially in case of posterior dislocation, the affected limb becomes short because head of the femur has moved upward out of the acetabulum. So the length of the limb reduces. So this was about the hip joint into overall. So I hope this video will help you out. If you still have any problems, you can uh, you know uh, ask for help.